All right, thank you very much. All right. First I want to thank Dr. Ross and Dr. Gould for the opportunity to talk to you about this. I had opportunity to be the video co-chair a couple of years ago, and the whole process from the administrative standpoint is a little bit tedious at times when you start watching a lot of videos and they start to run together. So I'll go through with you a few different points. Through this talk, I'm just going to talk about the video from conception to submission. A few of the things will be repetitive with what Dr. Heron said, and I'll try not to repeat those too much. And then we'll go over what happens to the video once it gets submitted to SAGES, and then some tips that I think might be helpful in improving the likelihood of acceptance. So as has been mentioned by the previous speakers, the video sessions are very, very popular. Most of them have standing room only, and if we think back to our early 2000s, late 90s, and I hate to date myself back that far, but submitting a video to the meeting was actually a great way to get on the podium, because sometimes it was hard to think of that great paper that you could write with some practice changing conclusion, but if you had some sort of a cool video to put in, you pretty much always got a presentation. So it was a great way to build your CV and get up on the podium. You know, everybody's very interested in seeing how each other does it. As Dan pointed out, we like to watch ourselves operate and see how we do it, but then we really like to compare ourselves to other people and say, hey, you know what, I can actually do that better. Or you look at it and say, wow, that's a really cool way of doing that. I'm going to try it the next time. And I think one of the biggest things that we always look for from the videos, and when you're submitting it, think about how you can put in the shock or the wow factor for the reviewers. So as Dan used a stepwise process, and we didn't do this together, we both came up with our own steps, but we're very regimented people as surgeons, so kind of tried to break it out as simply as possible. Okay, so when it comes to submitting a video, there are really three very basic things you got to do. You got to capture the interesting things that you do. You have to know how to edit it, which is probably one of the most challenging parts of it, especially if you're not familiar with the different softwares that you're using. And so we're going to see some examples of those things with the subsequent speakers. And then finally, actually submitting the video, which in and of itself can be somewhat tedious. So we'll go through each of these steps individually. So capturing the video, a lot of that Dan has already reviewed, but when you're, when you like to do videos, edit videos, a couple things to think about is, what's your strategy going to be? Am I going to be the surgeon who records all my cases? So just in case I see something interesting and want to put it into a video, then you're ready to do it later? Or are you going to selectively record just those cases which you think might be interesting or unusual in your practice? Strategy number one, recording all your cases, is great because you record everything and you never know when something interesting might come up. And oftentimes those interesting things happen to be situations that you're not that excited to be in, like lacerating the iliac vein, as Dan mentioned. But showing how you can get out of that situation and somebody else seeing how you got out of that situation if they had the same problem is very interesting for other people to see. When you record only the interesting cases, then you never know when something interesting might come up. For example, one of our residents at CASE last year had a very nice video presentation at the college of a laparoscopic cholecystectomy. You think about lap chole, I mean, that's a procedure everybody does, right? Why would that get on the podium? Well, the surgeon, who's one of the pediatric surgeons at our facility, recorded all of his cases, and they happened to have an aberrant right hepatic artery that was going over the front of the gallbladder, and then had they not been recording all of their cases, they would have missed that, but it turned into a nice video for the college. So I think it's really, it helps you to record all your cases, especially with a lot of the newer video technology that we have. It's easier to do that. And I will tell you, I work in a university setting where we do have the recording technology available, and I work at a community hospital where I actually have to record on DVDs. So it also depends on the technology that you have available at your institution. So obviously keep that in mind. And with that in mind, it's really important to train your staff. Okay, your staff needs to know when to hit record, when to start it. Not everybody has the record function on the camera head of their laparoscope. So you want to make sure that your staff is well trained and hitting the record button when they should. I actually got to do a really great case last year. I did a laparoscopic reversal of a gastric bypass. Did it like 2 hours. It was a great case. And we thought we recorded it, and at the end, the nurse didn't hit. I had a nurse who wasn't used to being in our room and didn't hit the recording button right, so nothing recorded. And so that was kind of a bummer. So make sure your staff is well trained and making sure you can actually do those things. As Dan pointed out, use the highest quality you can. And if you do have other technologies you're using, like Dan pointed out, have the recording ability available. And if you want to record your endoscopic procedures, if you go to the Flexible Endoscopy Committee page on SAGE's pages, they actually have a nice PDF of how to do that. Next step is editing the video. As Dan pointed out, and I'm not going to highlight too many things because he already went over most of this, but keep it simple and clear. Okay, the more straightforward your video is and the more to the point, the more likely it is that the reviewer is going to say, okay, that looks great, and use arrows and highlighting abilities to highlight the structures as needed. And your voiceover should be very clear. If you're going to be doing the voiceover and you speak with a very sharp accent, you may want to have a narrator or somebody who can enunciate clearly for you. And then step 3, that's actually submitting the video. Now, submitting the video can also be something that is very challenging because everybody waits to the last day to submit their video, and then the server gets overwhelmed with 1 million gigabytes trying to be pushed in right at the last minute. So please try to submit your videos a little before the last day. You'll have a much easier time. And then also follow the submission instructions. So if they ask for a 10-minute video, then don't submit a 15-minute video because they'll never get accepted. If, make sure that you're doing exactly what's asked, put it in the right format. If the reviewers try to open your video and it's not properly formatted, they eventually will get just frustrated and say, you know what, we have so many other great videos, I'm not even going to review this one, and just go to the next one. So what happens once that video goes through cyberspace and actually gets to SAGES? Well, then it goes to the video review committee. That's appointed by the program committee, and they score your videos, and the videos are also reviewed by the video chair and co-chair. And all the videos go through a scoring process, and they get scored, I forget what the actual score is, 1 to 5 or something? 1 to 7, and then basically they're put in order from highest to lowest. Now you can imagine if there are over 300 videos submitted, the video chair and co-chair are unlikely to watch all 300, so they'll probably take like the top 50 or 60 scored ones and then review those and decide what's appropriate for the video sessions. Now, a lot of what actually gets accepted has to do with the program chair, because the program chair will outline the topics that they think are important and relevant at that time in the world of surgery. So, you'll see that on the video sessions that we have for this meeting, one is very foregut and bariatric focused, and another session has a whole kind of a mix of videos. And then there's also a quick snapshot video session. So some of it has to do with the program chair. All the videos go into, you submit them based upon the category, whether it's a foregut procedure, colorectal procedure, and or a pancreatic procedure. Now, the more unusual a procedure you choose, that also is something that might make it more likely to get accepted, because foregut is very popular. SAGES usually gets at least 100 of the videos that are submitted are some sort of foregut type procedure. So in general, a much smaller percentage of those are going to get accepted as compared to liver resections that are done laparoscopically, because much fewer of those videos usually get submitted. Once the program chair outlines those sessions, the video chair and co-chair put them together, and then there's a PT-PT meeting, which usually is tagged to the end of the board retreat in the fall. Now you might say what the PTPT meeting is, and this is the put the program together meeting. And this is where all of the big work happens. So all the videos are reviewed at that point, usually with the video chair or co-chair, and they sit down with the program chair and say, okay, these are the videos I have, this is what I think we should take to the podium, and then they arrange everything and come up with a final schedule. And so that's the scientific process in which this happens. So how do you make the final cut? Well, first of all, I think one of the biggest things is the wow factor. So if you have a very unusual or rare case, that's one of the first things that's going to be most likely to get you on the podium. For example, on this meeting, we have a laparoscopic Pew-Stow procedure. A lot of people aren't excited about doing Pew-Stows open, let alone doing them laparoscopically. So to get that, to submit a video on that topic is excellent. Another way to get a video accepted is having a very interesting complication in how you handled it. There have been some videos, the video that was, let's see, let me think of a complication video. Actually, it was one of mine that's actually made it into the library at the American College of Surgeons, and here for complications is a ventral hernia video where I was working with my fellow and we dissected and taking down adhesions, we cut into the bladder, and then we had to fix it. And so everyone's watching it. Of course, when you look at it, it's the Monday morning quarterback, you're like, wow, I can't believe I did that. But luckily, we caught it on video, we fixed it, and it's something that you can submit to the meeting. So, everybody has complications. The only people who don't have complications are the ones who don't operate. Everybody wants to see how somebody else handles it. So if you can show that you can handle a tough complication with grace and ease, and with editing, you can make everything look graceful, then that would be a great video to submit. And then finally, I think the other wow factor is finding a unique approach to a common problem, and just as Dan outlined, your experience with 3,000 TEPs and kind of some special tips. So you can take a very simple thing and then outline the anatomy very clearly or present it in a way that would be new or interesting to the audience. Also, choosing the idea is obviously very important. It's a lot of times they say a picture speaks 1,000 words. Choose something that's better explained with pictures or video and use that as your topic, because that's something that's probably hard to put into words for an actual paper. And another is putting the right spin on a topic. If you look again at some of the video submissions, particularly some of the foregut, I think we've seen a lot of hiatal hernia repairs at this meeting. We've seen lots of paraesophageal repairs at this meeting. But if you look at some of the titles of some of these hiatal hernia videos, there's one that's three different very complex situations for hiatal hernia and how we approach them differently. And so that was a nice video that got accepted to this meeting. So putting the right spin on a common topic is another way to do it. Let's see, the other things that are useful to do to look at your video getting accepted is kind of looking at last year's videos. It's always a great way to see what are the things that are interesting to the audience of that meeting, and keep up with relevant topics to surgery or whatever are common things at that meeting. If you submitted a thyroid video to this meeting, it's probably not going to be as interesting to the viewership as some sort of GI surgery, considering this is a GI surgery group. So make sure your topics are relevant, and again, consider a new way to present a very unique, a very common problem. Thank you.